Hello, everyone. My name is Eddie Matamoros, and today for my general medical presentation, I will be discussing chlamydia. So let us begin. Starting off first, what is chlamydia? Chlamydia is a common sexual transmitted infection, or STI for short. It is caused by a bacteria called Chlamydia trachomatis. Anyone can get chlamydia. It often doesn't cause symptoms, so people may not know they have it. But however, antibiotics can cure it. It is most known bacterial STI in the United States. It's often called a silent infection because 70-90% of infected individuals have no symptoms. And as you see right here, there's anatomical sites on how you can contract it. How does chlamydia work? So it can cause inflammation, discomfort, and long-term reproductive damage if untreated. It invading human cells using the host's energy and resources to reproduce, and then spreading to new cells and tissues in a cycle. Transmission occurs through vaginal, anal, oral sex, or from the mother to newborn during childbirth, which is kind of sad if you think about it. And it's just that same life cycle, like on a bigger image. The one I had in my previous slide wasn't that big; it's kind of small, but just to kind of show you, give you a general idea. How's it caused? It's caused by a bacterium called Chlamydia trachomatis, like I mentioned previously. It is spread primarily through unprotected sexual contact, having multiple sexual partners, and lack of regular STI testing. However, it isn't spread through casual contact, toilet seats, or sharing drinks. Symptoms, as I mentioned earlier, often none. Most people show no symptoms, but symptoms that can occur is that it can be painful, a lot of urination, lower abdominal pain, abnormal discharge, pain during sex, testicular pain in males, as well as rectal pain or bleeding. And here's a little side-by-side difference with men and women. See painful ejaculation with men, penile discharge, testicular swelling. Or with women, it's painful intercourse, vaginal discharge, and bleeding between the periods. Effects on sport performance. So some direct effects is that pelvic or abdominal pain can make running, jumping, or lifting uncomfortable. Fatigue caused by infection can reduce endurance and overall performance. Indirect effects. Untreated infection may lead to serious complications, PID, infertility, affecting long-term health. Emotional stress or embarrassment about symptoms may affect concentration as well. Also important to know, chlamydia obviously can have a negative effect on sport performance through a variety of mechanisms, primarily through fatigue, muscle weakness, and joint pain, and potentially leading to serious complications like myocarditis, heart inflammation, if left untreated. The impact can range from general malaise to significant long-term health issues that disrupt training and competition. Mild cases may show no obvious performance impact, which is why screening is crucial. Treatments. Doxycycline, 100 milligrams orally twice a day for 7 days is a preferred regimen that most people use that have the disease. Or often an alternative one is athromycin. I'll probably butcher his name, so please forgive me. 1 milligram orally in a single dose. Often used when adherence to a multi-day course is a concern. Sexual partners must be notified and treated. Avoid any sort of sexual activity for 7 days after completing treatment, and retest is recommended after 3 months to ensure no reinfection has occurred. Prevention, using condoms or dental dams constantly and correctly, limiting a number of sexual partners, getting regularly STI screening, especially between the ages of 15 to 24. Avoid sexual activity until partners are tested and treated if needed. Always have open communication with partners about STI history. Other information. Women who don't treat chlamydia can lead to pelvic inflammatory disease, which can block the fallopian tubes, causing infertility as well as chronic pelvic pain. Men can also become infertile as well too. Chlamydia can increase the risk of getting or transmitting HIV. And pregnant women with the disease might not only transfer the disease to their unborn child, but may lead to premature birth or low birth weight. All right, finishing off, we're going to give the 10-question quiz. So out of the first 5 questions right here, true or false, chlamydia is caused by a virus. Number 2, chlamydia is commonly spread through sharing drinks, vaginal, oral, anal sex, or skin-to-skin contact. Number 3, the name of the bacterium that causes chlamydia. Number 4, true or false, most people with chlamydia show noticeable symptoms. Number 5, which age group has the highest rate of chlamydia infection? Is it 10 to 14, 15 to 24, or 30 to 40? Here are the answers. I'll be showing you right here. False, chlamydia is caused by a bacterium. It's not a virus or fungus because it's bacterial, so it can be cured with antibiotics. Number 2, it's vaginal, oral, anal sex. It spreads through direct contact with infected genital fluids during sexual activity. It cannot be spread by casual drinking, hugging, or sharing drinks. Sorry, casual touching. Number 3, the bacterium is called Chlamydia trachomatis. This is a scientific name for the bacteria responsible for the infection. It affects the genital tract, throat, rectum, and sometimes the eyes. Number 4, it's true. Most people show no symptoms. Like I mentioned earlier, about 70 to 90% of people with chlamydia never show any symptoms. That's why it's known as a silent infection and why it's important people get regularly tested for it. And number 5, it's 15 to 24. Chlamydia is the most common in sexual active teenagers to young adults. This age group tends to have higher rates of new partners and lower testing rates. It's kind of scary. Alrighty, and the rest of the questions. Number 6, one potential long-term complication of untreated chlamydia is. Number 7, true or false, chlamydia can affect athletic performance. And then number 8, the standard treatment for chlamydia is antibiotics, antivirals, or steroids. Number 9, name one method to prevent chlamydia. And number 10, after treatment, individuals should avoid sex for 24 hours, 3 days, or 7 days. Here are the answers. So number 6 can go couple ways here. You can go do pelvic inflammatory disease, infertility, or chronic pelvic pain. And number 7, it can affect athletic performance, doesn't directly target muscles or joints. Symptoms like pelvic pain, fatigue, or general discomfort can reduce energy, endurance, and focus during sport activities. Number 8, antibiotics, like the 2 I mentioned, doxycycline or azithromycin. They kill the bacteria. Antivirals and steroids wouldn't work because the infection is bacterial, not viral or inflammatory. Using condoms, non-using condoms, regular screenings, and limiting partners. Prevention focusing on reducing exposure to infected bodily fluids. Condom use and regular STI tests are most reliable methods. And then number 10, 7 days. Most people must avoid sex for at least 7 days after starting treatment to prevent spreading the infection or getting reinfected. Alrighty, thank you for watching my presentation. I hope you enjoy the rest of your day. Have a good one.